Hey guys, I hope you are all doing well on this fabulous day. I've got an absolutely amazing occupational therapist on the show today. Devlynn Neu is a travel OT currently practicing in a skilled nursing and rehab facility, and is also the creator of the Rainbow OT blog. He is one of those people that is so passionate about advocating for others, as well as the profession as a whole. In this chat, we discuss inclusion, identity, education, and considerations for therapists and clients in the LGBT plus community. So let's jump on in and explore all the colors of the rainbow with the Rainbow OT. If you're interested in occupational therapy, this is the place for you. This show aims to explore our profession by sharing who we are and what we do. Because for us, occupational therapy is more than just a job. Hi, I'm Sarah. Welcome to OT for Life. Well, welcome, Devlynn, to the show today. I'm so excited. I'm so happy to have you. How are you today?
I am doing so well, magical, if I do say so. I'm so excited to be here, Sarah. I have been waiting about this. This is the cherry on the top of my day, so.
Yes, I'm so excited. So excited. I want to keep saying it. I'm so excited to have you on and talk about something that I really think needs to be talked about more and needs to be heard more and more in our profession. I mean, in society in general, but in our profession specifically. I kind of wanted to start a little bit with talking about AOTA's vision of 2025. And I'm definitely going to link to this in the show notes and give respect to AOTA. Basically, I'm going to read it. It says, as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. I think just starting with that, I think is really, really important because there are so many people within this world and we all come from different backgrounds, different cultures, different genders, different identities. But I think just identifying and then highlighting and sharing this view that the American Occupational Therapy Association has kind of set forth for us as a profession is a great way to kind of start this episode.
Well, you want to know a fun fact? Is that under the inclusion part from 2025?
Yeah.
Yeah, so that pillar, because I do want to put this out there, I did talk about this in my ABCs as well. All of the love to AOTA for adding inclusion, but that was actually something that was amended into the Vision 2025. So at AOTA, you know how there's that business MDS meeting where the different subgroups of AOTA can go, or anyone can go to and bring up issues or concerns with AOTA. The network, which I also referenced in my ABCs for LGBT plus concerns in occupational therapy, addressed the need to add inclusion to our vision of 2025. So that was a really awesome collaboration between two groups to make sure that we included everyone and got the true message across in the vision.
Awesome. I did not know that. So thank you for enlightening me about that, because I've gone to a lot of chats about moving forward and modifying the vision. And I think just learning from everybody and making sure that it's kind of all encompassing and making sure that we're representing everybody within our society and within our community is really, really important.
Amen. Amen, sis.
All right. So what I'm thinking is that maybe we'll start with a kind of general overview of, and I'm going to try to get this right, the LGBTQIA+, and what it is and what it means.
Okay, so I love that you mentioned getting it right. I know we chatted about this before, but it's awesome that you're just trying to understand. And again, thank you so much for setting aside this time to listen and talk about something that not everyone maybe feels comfortable talking about. And I know that there may be a level of discomfort for you just because it's a different topic, but kudos to you and hats off to you for taking on something that a lot of other people wouldn't. So yeah,
hold on. We'll get back to my question. I think we should expand on this because it's a good place for it. To be honest with you, it is a little uncomfortable, especially if it's not something that you deal with or you have dealt with in practice or that you're living yourself. And so as I was preparing for this episode, wanted to make sure that I got it right, wanted to make sure that I did my best to represent all of the members of this community. And so I know that I kept asking questions like, well, can I say this, or how should I address this? And as that was happening, I really started to reflect on, this is actually something really good to kind of share with everybody, that it is okay to ask questions, because if you're not familiar with it, that's the only way that you're going to learn.
Right. And I want to note too, like for myself, even as a member of the LGBTQIA plus community, and I can only say it so fast because I've practiced, I'm not always right when I speak on these subjects as well. There's a lot of room for me to learn when it comes to, for instance, transgender specific ADL tasks, or what other letters in the acronym stand for, or what that means to someone. So I think for everyone, it's just falls under the same concept that we're just constantly learning, and we have to, I guess, be open to that type of learning. But yeah, this is a topic that can be super sensitive, which we will dive into later, but just involving identity of gender or pronouns or sexual orientation, like these are very sensitive and emotional topics for a lot of people. So I know that it can be difficult to talk about, or, be afraid to say the wrong thing, which is, it's better to say something and be open to learning about it than to not say anything at all.
And I also kind of wanted to say, too, that as we're talking about it, we are both coming at it from our own experiences and from what we know. And that might not encompass everything that's out there. And so, of course, if anybody is listening to this and they have feedback for us, or something that maybe we don't talk about, please reach out, let us know, so both of us can continue to learn, as well as the profession as a whole. So definitely we want to make sure that we are being as all-encompassing as we can and represent every possible community, every possible term that should be talked about.
Yeah, amen to that too. Just serving up a hot plate of realness over there, Sarah.
Hey, you know me, right, Deb? Okay, so I know I already asked the question, but now that we kind of got that out there, let's dive in. What do these letters mean, and what kind of emphasis does it have for our profession?
Yeah, so I think to start with the emphasis on our profession, this all falls under, at the broadest umbrella, identity and who we are as a human. To start off, how we identify, it branches off into roles and our occupations, because identifying with, as a member of this community or with one of these letters, can have an impact on who we are as a person and what occupations we engage in. To branch off, we'll start with L. So L stands for lesbian, which is describing a woman who's primarily emotionally, physically, sexually, spiritually, in every way attracted to another woman, so of the same sex. Then there's G for gay, which is men who are attracted to other men, emotionally, physically, etc. There is B for bisexual. So these are individuals who are emotionally, physically, and sexually attracted to more than one gender. There's transgender. So this is talking about specifically gender, not sexual orientation. So this is someone whose gender identity is different from the gender they were thought to be at birth. So trans is often used as the shorthand for that. Cisgender, which is, I know, jumping out of the acronym. Sorry, y'all. Keep your seatbelts buckled. We're going to go all around today. Cisgender is like single gender. So then you identify with the gender that you're thought to be born as. So transgender and cisgender are typically the two genders, although there's also gender nonconforming, which is not conforming to either gender. So moving on to Q. So Q stands for a couple of things. It can either stand for questioning or for queer. So I'll start with queer. Queer is really an umbrella term that's used to describe individuals who identify or who do not identify as heterosexual or cisgender or non-transgender is also another way to say that. Queer is kind of an all-encompassing term. I know when you talked about it, you were like, what's the best way to refer to that community? Because it's easy to get jumbled up when you're listing the acronym, but you can identify it as the queer community, but a lot of people or some individuals don't like this term because it does have the historical use as a derogatory term. So, but it also means questioning, the Q in the acronym. So those are individuals who are unsure about or exploring their sexual orientation or gender identity. So that's the LGBTQ. And then plus is just encompassing of other letters in the acronym. So I stands for intersex or between the two sexes. A would be asexual. So those are the letters in the acronym for, I guess, the most commonly represented, and the plus is all encompassing, so that way we don't leave any individuals out.
Okay. Yeah. And I feel like even over time, at least that I've kind of seen, is that new letters are being added / modified to make sure that we are including everybody. And I think the important thing to kind of highlight here is that even though we're kind of talking about it in this way, not everybody is going to associate or feel that one of these terms is the correct one for them, and really kind of putting aside our own biases and our own understanding to make sure that how the people that we are talking to, the people that we are interacting with or talking about, it's how they want to be represented and how they identify. Not always how we think that they should identify, or because we know, because you're going over these letters and what they mean, this is how I have to apply it to everybody. I think really having that lens of how the person, how the client, within healthcare, how they identify themselves.
Yeah, and that's the most important thing. And I just love you, Sarah. I'm going to say that at least 100 times this episode. But so to go off of that, it's simply about doing our job as therapists. And I like to address it from this way because then there's not really any way your personal beliefs can get involved in it. But it's developing that occupational history and that occupational profile. And their identity is a part of that. When we go into a patient's room or when we get a new child in the classroom, we always address, ask the parents or ask the patient how they want to be identified. Do they have a nickname, or what's their preferred name? It's not much more for us just to ask, how do they identify, or what is your identity? And you can leave it vague like that. And if a person knows what that means and they're comfortable with you, they may give you their preferred identity, or they may just take that as their name, and you leave it open for whomever to answer however they want. But at the very forefront of it, it's just all about the person and being client-centered and addressing them and identifying them, how they identify themselves.
I'm so glad you said that. I think that's really, really important. Just across the board is really kind of putting the client first and making sure that they feel like they can trust us, and that we as therapists understand them, and that we take the time to understand them. And I think really kind of going through the occupational history and the occupational profile is just a great way for us to connect with our clients and to ask these questions that go beyond just basic ADLs, or just kind of glance over the surface of what is meaningful for a person, but really kind of getting to know our clients on a deeper level and understanding exactly where they're coming from, how they want to be represented, how they want to be addressed. I mean, something as simple as that. I actually have a story about that happened to me today. And I think it's really, it's interesting that here we are having this discussion, but I was boarding a plane this morning, and I had my hood pulled up, and my hair was all tucked in, and you really couldn't see much about my face. And the guy at the airport, when he took my ticket, was like, "Thank you, sir." And I kind of stopped, and I turned around and I looked at my husband, and I'm like, wait a second. And it just kind of, it caught me off guard, because I was like, wait, what is going on here? And really it's that I'm sure that happens to our clients that are within this community all the time. And I don't even really have any thoughts about it right now, just because it just happened, but it definitely caught me off guard and made me stop and think for just a second.
Well, and it's so important that you bring that up too, because when you sit down and first of all, you're even taking the time to digest how that feels for you, which is awesome. But if you sit and you think about how that feels for you, and you're like, oh, well, it doesn't really mean anything because, I have all these affirmations that I'm a woman and whatever, that was a fluke for you. But imagine that being, someone's everyday being misgendered or misidentified, and then be in the process of transitioning and maybe not have as many things externally that validate your gender and how that may make you feel. So when you can sit there and you can empathize, on the level of that it happened to you, but then take those next steps, it's really, I think that's something that all of us as practitioners could take more time doing. Not even just in the aspect of identity or gender or sexual orientation, but just in general, taking some more time to sit down and digest how we feel about things and how we can empathize with our patients. But that's a really nice little reflection you brought up, Sarah.
Yeah. I feel like in some of the posts that you've put on Instagram, one of the big things that I've kind of taken away from it was the importance of pronouns and the use of pronouns within our professional language, especially when we're addressing clients. And so I just kind of wanted to give you a minute to tell us a little bit more about what that means to you and how we as therapists can be a little bit better in having respect and the use of pronouns.
Yeah, so pronouns. Again, going back to identity, and I can't stress identity enough, especially us as OTs on a multidisciplinary team. I think we value identity the most. So all of this at the very root of who we are comes back to identity. So I always want to tie that back to OT because it's relevant in everything that we do. But pronouns are how someone wants to be referred to or talked about. So again, identity. Typical, he, him, his, those are my pronouns. Those are how I identify. Do you have preferred pronouns, Sarah?
Yeah, she, her, hers.
Yeah, and then another common set of pronouns is the singular use of they, them, and theirs. So really it's just saying they, them, and theirs if they choose to identify that way. In my personal experience, I have found those who are gender nonspecific or nonconforming and or transgender will use they, them, and their pronouns most commonly in the community. There's also a set of pronouns, and I might mispronounce these myself, so I'm going to go with the ones that I may do better, which is z, zir, and zirs. Those were also referenced as common pronouns for individuals. So basically, how I address this when I go into someone's room is I ask them, again, how they prefer to be identified. And I will refer to myself as he and him. And again, I try not to directly state that I'm looking for an identity or pronoun, but I use words that leave it open for someone who may want to identify specifically. Because in my setting where I work now, that's how I feel safe as a gay practitioner. So that's pronouns. That's just how someone would like to be referred to or identified as.
Do you feel like you kind of just take more of a general approach where you leave it open to having them be able to answer the question? Or are you giving specifics of how do you want me to address you as a person?
I personally leave it general, and I do have an instance where this is actually somewhat recently. I had a patient who painted his nails, and I came in also to a very rural facility as an openly gay man and healthcare worker, and I was like, well, I'm going to ask this individual their pronouns and identity, and for them, he was almost aggravated that I asked him pronouns or asked him something different than just what his name was. So I think going too far could also imply an assumption where that individual may have just liked wearing nail polish. So I like to leave it open. I also wear a special pin that I can refer people to that has a gay flag on it and a transgender flag on it as the universal health symbol. So for me, using very general questions that do leave it open to either those with specific identities or those who don't think anything of it can both freely identify as they wish to. And I wear a pin that somewhat identifies me individually, but also identifies myself as a safe space for all individuals. So that also helps with me just leaving it very open to whatever the client is comfortable with.
Okay. Yeah, because I think it is kind of important to discuss like how to actually bring this up as a therapist working with a person. And you might not know specifically how they want to be addressed, what their pronouns are, and how you can incorporate that into your questions and your getting to know of that person. Do you have any like simple little, strategies or tips that could help somebody be a little bit more all-encompassing or just a little bit more respectful?
Yeah, so I actually chatted this about a follower on Instagram, but I like to use words very specifically. So when I do ask someone about their name, I don't ask them what their name is or their preferred name. I ask them how they identify, because identity is all-encompassing. So I have had in the past those who identify in the LGBT plus community open up and give me pronouns through that question. And I've also had people just give me a preferred name or a nickname. So using words like identity that are more broad but also comfortable for those in the community. And then what I would say after that is also, if you do by chance misidentify someone or maybe assume someone is a Mr. or Mrs., just be open to a correction from that individual and implement that correction going forward and educate others on the proper identity, because that's going to make a huge impact too. We're not always going to be right, and it's totally not a personal thing if you're corrected on how to identify someone properly.
Yeah, and I think this will be a good point to kind of pull in some of these statistics. I think they're going to be kind of shocking to our listeners, but I think just like reflecting on, if you do misidentify somebody or call them by a name that is not how they want to be identified, really the impact that it could have on them emotionally, physically, just kind of the damage that can be done without really you even knowing it.
Yeah, and without you even knowing it, but especially for those who maybe do know it or maybe don't correctly identify someone just based on their own personal beliefs. But I'll start here and we can branch off into other areas. But this is one that really always grabs my attention. So this was a survey completed in 2014 by the National Gay and Lesbian Task Force, which I must add sounds like a really badass organization name. I feel like it's the Avengers of the LGBT community in healthcare. So I want to be a part of this task force. If you, whoever and wherever you are, let me in. But so in 2014, they completed a survey in conjunction with the National Center for Transgender Inequality. And what they identified in this study is that those who identify as trans male or female to male transgender individual had a 46% higher rate of suicide attempts due to their experiences in healthcare. And for trans women or male to female individuals, they had a 42% chance of a higher suicide attempt rate due to their experiences in the healthcare setting. So that's very, very specific to where we exist as occupational therapists. So taking aside just the general statistics of suicide attempts and due to healthcare experiences, they're almost 50% higher for both trans men and women based on how they're treated in a healthcare setting.
That is not a small number. That's insane to me. Like as you were saying that, I'm just like, whoa, that's a whole lot higher than I was expecting to hear.
Yeah, and so that's from 2014. There was a 2016 study that noted that these numbers could be up to 50% for both. Wow. So it's not decreasing as time goes on.
Mm-hmm. And it's specifically healthcare. Like, we're not even just talking generally here. It is something that happens within the healthcare setting. And I just think that is such a kind of pivotal thing to shed some light on, because I don't think it's something that's talked about a lot, specifically how somebody identifies and how they feel like they are treated within the healthcare setting. Like, I'm totally at a loss for words with that.
I don't, so am I, if you can't tell by my inability to word find, but so that is just in healthcare specific settings. So I do have a school-based one too, because I feel like it's even more important to talk about it at this age. So this was a school-based survey from 2017 of over 1,300 students. 10% of the 1,300 students identified as LGBT+. So all the children in the study were 13 to 19 years old. For those who noted suicidal ideation of the 1,300, 30% of LGBT plus individuals noted suicidal ideation versus the 6% of heterosexual individuals in the study. So that's a 30% to 6% for noting suicidal ideation, when only 10% of the 1,300 identified as LGBT plus. So that's 30% of the 10%.
Wow.
For self-harm, so acting on that ideation, it was 21% for those who identify as LGBT and 6% again for those who identified as heterosexual. So again, a much larger number, a statistically significant number for those who identify in the LGBT community in a school setting.
And what do you feel leads to these kind of suicidal thoughts and the self-harm? Like, what types of components, what types of challenges do you feel like these, specifically like the students or the people within the healthcare statistics as well, what do you think contributes to that?
So some of this was noted in the studies, but a lot of this I think we can just put together based on our knowledge of society and just growing up, in general. But bullying is huge. I think like lack of inclusivity. I know that there is also a statistic. I don't know the exact statistic, but I want to say it's close to about 50%. So if a school has something called Gay Straight Alliance, which my high school did, my college did, so I'm very thankful for that, it lowers the suicide rate of LGBT plus youth by about 50%. So just having that sense of community or identity and inclusion in a school setting lowers the risk of that by about half. And I'm pretty certain it's around the 50% area. So I think bullying is huge. We know that nowadays with access to social media and technology and all of those things and anonymity on social media, but also just identity and inclusion, these things that don't go away when you're, just a child and they grow into something just as large in the healthcare setting. I know that in the study that referred to the healthcare specific setting, it noted identity. This is just so gross to talk about for me, but for therapists, nurses, and doctors who intentionally misgendered or misidentified patients, so that was like done just out of malicious intent. So again, that goes back to bullying and harassment, but these are coming from the healthcare workers. So this whole study really hit home because this is coming from people that we may work with or have worked with. But these attempts were higher for people just based on the responses of their healthcare workers, which is just so crazy to me because all of us as healthcare workers, I would think, just go into this to help people no matter what or where they come from, and whatever that means based on your profession. So to see that the suicide rate was worse based on how healthcare providers treated other patients shocked me into wanting to make some sort of change on this because those numbers are so high.
Yeah. And I feel like sometimes this is done unintentionally. Like sometimes it just happens where somebody says something and they're wrong and they didn't mean it that way. It was just like, that's just kind of what happened. But the fact that you were saying that this was like intentional, that's disgusting and so inappropriate. And going about it that way is just so much more negatively impactful for the clients that have to go through something like that, where it should be professionals that they are looking for to help them, to guide them, to help them get better, to help them get through a difficult time. And all of a sudden they are degrading, demeaning. It's awful. I can't even stomach that.
Yeah. I don't even know what to say on the subject because it's just so crushing to me. I don't have another word for it besides just knowing that we need to make a change, some serious change, not just sweet nothings, like we have to do something as healthcare professionals to represent and advocate for these communities because there's a giant hole in healthcare when it comes to properly treating them.
Mm-hmm. And that's exactly why I brought you on the show today, because I think just having this conversation and having continued conversations about this subject will kind of shed some light, will bring to the forefront some of these issues, some of these statistics, some of all of this stuff that I'm guessing some people haven't heard before, or you've really taken the time to kind of reflect on, and especially within a healthcare environment and a healthcare climate where we are going in, we are helping people, we are a very intimate profession and going in and really diving deep into what is meaningful for a person. I mean, we haven't even talked about like very specific activities of daily living. Like we're just talking about how do you address a person? How does a person identify? These are very, I want to say these are terms that should be applied to everybody, but yet, according to the statistics that you just said, a lot of times they're getting overlooked and it's actually demeaning to people when really what we should be doing is building them up and not putting them down.
Yeah, and I want to piggyback. I have more stats for you.
Ooh.
No, everything you said, 110%. I'm right there with you. But I found a study that I think maybe may shed light for both of us. Just this is specific to healthcare providers. So that it was a survey done to test the treatment of LGBT plus individuals in healthcare. So it was, and the knowledge on proper treatment of. So in a survey of 6,000 staff members from, I believe it was 18 large organizations, along with 640 leaders from these organizations, it was found that 81% of those individuals were familiar with LGB needs, so lesbian, gay, or bisexual needs. To me, I mean, again, this is coming from my own experience. I don't think there are too many specific needs for people who identify as gay specifically, lesbian or bi, especially when you compare it to other identities. But 68.3% reported they were familiar with trans needs, which I think that may have been a perception of familiarity just based on my new knowledge of trans-specific care. So this is kind of wrapping back around to when we talking about sexual orientation or identity and how you ask that. So 55.4% reported never infrequently talking about sexual orientation with their clients, and 71.9% reported never discussing gender identity, noting that they felt like they did not believe it was relevant to the care of the patient. So that's 3/4 of 6,000 staff members who didn't feel like discussing gender identity is important to their clients' care, following the statistics I just shared with you about how impactful identity is on a client's health, specifically their mental health and suicidal ideation and attempts. Mm-hmm. So there is probably where a huge error lies within our system, just valuing gender identity or just identity as a broad term as something that is relevant to the care.
And I think this kind of goes back to just that inclusion piece, making sure that we are not excluding people, that we are trying to include everybody within the healthcare setting, and just making sure that everybody is being represented in the ways that they want to be represented. I would really like to know, what are some challenges that you have faced being an openly gay therapist and working within the healthcare setting?
I have been fortunate when it comes to coworkers, so I don't have too much to comment when it comes to that, although I know that's not the focus of the question, but
no, that's okay.
I have, for the most part, had very, very supportive teams or not been the only openly identifying individual on those teams. So when it comes to my general rehab teams, I've had a great experience. When it comes to patient care, I have definitely had I've had some experiences where I was uncomfortable, or my openness, or maybe the assumption of my openness, hindered the care that I was able to provide. So I have had patients of both male and female gender deny my care based on my orientation, whether that was because overhearing a conversation of me and another coworker, where I was open with my identity, or by wearing the rainbow pin that I wear, or, I have rainbow socks too. I pretty much have rainbow everything, I think, at this point. So somewhere along the lines, my sexual orientation was either assumed or discovered, and because of that, I was hindered from providing care to that patient based on their viewpoints, which, as the therapist, I have to honor and do so, as the patient wishes, as they have the right, as we both know, to refuse care or to have preferred care.
Now, can I ask, would they specifically actually say it to you and say, I don't feel comfortable because for whatever reason? Or was this something that they would talk to somebody else and then you kind of hear it from the grapevine that you were removed from the case?
So both. I've had men who tell me that they aren't comfortable with my kind, or other words, engaging in a bathing task or other personal care tasks with them. I've also had a woman tell me that as well, but I found more with my experiences in women, and I'm talking about maybe, I think off the top of my head, 5 patients out of the hundreds that I've spent time with. So fortunately not a representative example, but I've had more women note to other individuals that they're not comfortable because of that reason and not directly to me. But it has definitely been both.
And how did, I'm going to ask the tough questions. How did that make you feel? Because I know you're so big about inclusion and advocating and kind of standing up for this community, and to then kind of have it thrown back at you for somebody that's like, no, just because you identify as gay, I don't want to work with you. Like, really talk us through like how that impacted you.
Okay, well, I can start off by saying it makes me feel like absolute dumpster fire. I don't feel good when that's mentioned, or that's a reason maybe why a patient doesn't want my care. Now, maybe if it has something to do with my personality or we just don't gel well, I can totally digest that. That is natural. That happens with everyone. But when it's because of how I identify and how I was born, and without going too far down that road, it's not a choice. You know, this is who I am and who I was born as, and something that I can't change or modify or address differently, like that sucks, because it's a part of myself that I am so proud of and choose to be proud of and strongly advocate for. But it's also a part of myself that sometimes isn't openly accepted, and I have to swallow that pill, and it's not a fun pill to swallow. But at the end of the day, I remind myself maybe it is personal, but it's also not personal, and what our clients say to us or how they feel, that's not to be taken personally in certain margins, I guess. So I just know that at the very end of the day, I'm most concerned with them being safe and them being able to do things at their best ability to get back to what they were doing. So if that means that they have to work with maybe a female OT or another OT for their shower, and they still achieve their showering task and they're still independent and they're still safe, then that's still me doing my job to the best of my ability. And I have to find comfort with that too.
Have you come across any other challenges?
So I've had a female home health aide, a privately hired one, make sexual comments about me after discovering my sexual orientation and thinking that maybe it's more okay for her to make those comments about me or my body, which for anyone questioning that, it's not more okay for you to comment about my anatomy or my body. So because I have been more open, some people are more comfortable to say things maybe they wouldn't say to other people. I have had that. That was a new thing as of the summer in California. So thanks for that, California.
Hey.
No,
not
really,
all of us Californians will do that, okay?
Yeah, I know. Super isolated case. But yeah, so I've had that. I want to know, because I know we've talked about a lot of serious things, but I've also had some really wonderful experiences where I've used therapeutic use of self, knowing that a patient, has a family member or son that openly identifies. So maybe I'm more open with them in knowing the relationship, if it's a positive one or something. I certainly wouldn't want to put myself in that situation if they despise their child or something because of how they identified. That would not be a safe or smart position for me. But I've had patients that it brightens their day, or they're older and they weren't able to live the open life that I'm able to live in their time. So I've had some really special experiences because of it, but it's important to note that just as with everything else, there's always two sides to it. Do
you have any advice for somebody that might be in your situation? I know you said that specifically, like, your coworkers have been very open and very just amazing all around. But any advice for a therapist that this is either with coworkers, with management, or from the client side that is experiencing any kind of difficulty because of the way that they identify?
Yeah. So everyone's experiences, as we've noted, are going to be super different. But my advice, and this is something that I'm still learning and setting boundaries on, but just do whatever makes you feel comfortable or safe. You don't have to out yourself. This is something I will just touch on, but I heard this on a Queer Eye interview. Big fan. But Karamo, to paraphrase it, said something along the lines of, we shouldn't be coming out to people. It should be more known as us letting other people into who we are, not coming out and putting some part of us out there because it's there no matter what, but letting other people into, what's really special to us. So use your judgment if it's maybe appropriate, or if you feel safe letting other people into who you are. You can, just to not be, I guess, too repetitive in what I talk about, but you can refer also back to Tailor-Made OT's OT Time with Me on her Facebook page, where I talk about being out or the process of letting others in / coming out as a healthcare professional. It's on your own terms. You do not have to do that with coworkers or with patients. With patients, for me, I go through kind of a series of internal questions, whether or not it's going to be beneficial to therapy, or whether or not that's safe for me, or if it has any relevance, to anything that we're doing. I don't necessarily have to be out in order to be myself or be open with patients, and same thing with coworkers.
I really like that you just said that, because I think a lot of times we as people, everybody, we always put a lot of pressure on ourselves as to what is expected. What do other people expect that we should be doing, how we should be acting, what we should be saying, like you name it. And really it's that comfort in who you are. And I love that you said like letting people in. It's not putting yourself out there to meet the expectations of society. It is allowing people into your space and allowing them to get to know you and what you're comfortable with. And I feel like that kind of just like lines up. I always kind of say, if you can sleep at night. So it doesn't matter what other people think of you. And I say you generally. If I can go to bed and I'm happy with the way that I did my job, I was happy with the way that I interacted with that client, I was happy with the way that I conducted myself, and I can sleep at night, that's really what matters. And it shouldn't just be based on this like expectations or this pressure of what other people expect from us. Yeah.
And I think there's just a lot of pressure. At least for myself, like without going too much into this subject, that's more of me just saying that for myself, because I can talk all day, as I know you know, Sarah. But yeah, so whatever you feel proud of, or like you said, lets you sleep at night, 100% just be true to yourself. And if being true to yourself is not letting other people in, then that's totally okay. And if that time ever comes to let them in, or you want to do it, if not, that's totally okay too. On my second field work, it was a comfortable environment, but maybe not comfortable enough for me to let other people in and disclose my sexual orientation. Were there assumptions? Literally always. But that wasn't something I ever felt the need to identify, and everyone was totally cool with that too. So it's really just whatever you're comfortable with and whatever is true to who you are.
Yeah, love that. I think that's great. And I also wanted to say we will definitely make sure that we link to Tailor-Made OT's OT Time, because I know that you kind of go into some more detail about some of these things. So if anybody wants to hear a little bit more from Dev and his experiences, definitely check that out, because it's good. There's some good stuff there. All right, Dev. So I know that we recently completed Shannon Marie OT's ABCs of OT, and you had some amazing, amazing posts that really highlight some of the things that we've been talking about today. And so I kind of wanted to jump in and discuss some of your letters that you did. And we've already been covering your A was advocacy. And I feel like a lot of what we've been talking about is advocating for yourself as a therapist, but also advocating for our clients. And I feel like that is something that is so important to you. It just oozes out of you of like advocating for you yourself, but also your clients.
Yeah, I have always been outspoken, or been able to use my voice. As I told you before our interview started, I do get nervous, but it's also so empowering when you can use your words to especially speak for some people or for a group of people. Not that I represent that whole group, but for maybe people that don't get listened to or don't get an opportunity to speak on things. So when it comes to anything for our clients, for any disability, for people that have a harder time being heard, I have no problem helping them be heard on those subjects. And I think that it's super important for those of us who are okay talking about things to talk about things, because that's not everyone's situation.
And so maybe let's talk about specific things for therapists that we can be considering when we are working with somebody that identifies within the LGBTQIA+.
I think I also have to stress that it's not all so different. And that's a really important. There are a lot of things that are different, and we're talking about specific identities or specific pronouns, and we're going to talk about specific ADL things. But at the same point, we have to wind it back and remember that all of us are just looking for the equal treatment that we should receive, no matter what we identify as or for our gender or whatever. So I think it's important to emphasize that too. But as OTs, I think that we have a very unique role in making an impact on LGBT plus care, whether that's for the practitioner or for the patient, because we do have such a unique scope on how we view and learn about a client. We learn who they were and who they are and who they want to be. And not every profession takes a look at that. So for communication amongst the team, like when I had the individual I referenced that painted his nails, I asked the rest of the team, has anyone asked him about his identity, if he prefers to have an identity? And everyone said no, and they didn't think to do that. And I think maybe that's because of where I come from as a therapist and being openly gay, but I also would like to think that an OT, no matter what, would ask the identity or get that out of a patient, and we could be the ones that communicate that first. Maybe it's just a lack of knowledge or understanding. So since we do such a unique interview and establish profile and history based on their occupations, that's a perfect opportunity for this type of conversation to come up, or to leave an open, comfortable space for a patient to identify. And then we can at least bring awareness to that amongst the rest of the team and use resources that may be unique to the LGBT community to help that patient with their specific needs. So I think we could really just start with communication and doing the job we already do, just paying a little extra attention to identity.
Yeah. I also just think that a lot of times a lot of topics just kind of get brushed aside, and this being one of them. So really just having that awareness, and I think you nailed it. You said a lot of times there's kind of a lack of awareness or a lack of knowledge. And so really having the awareness and having the knowledge to ask these questions, but then also promote it to your team, whether you're in a hospital, whether you're in a school, whatever facility, whatever entity that you're operating under or as a part of, and really kind of advocating to make it a part of what others are also starting to think about too. I think we have such a unique lens and a unique skill set to bring to the table. So utilizing it with our clients, but then also making sure that we are continuing that kind of advocacy effort with the other people, the other professionals that we encounter as well.
Yeah. And even just as OTs, when we ask these questions too, I found a nice little table where inclusive wording is there. And this is for all healthcare professionals, not just OTs, but just speaking as an OT and from an OT standpoint. Instead of asking in the interview, which a lot of us conduct, are you married? Maybe ask, are you in a relationship? Mm-hmm. Because especially not all states do LGBT individuals have the ability to be married to someone, to their significant other. Asking them who they brought with them instead of saying, is this your husband or wife? Mm-hmm. Or what will your family take care of you when you're home? Who will take care of you? So just leaving words more broad generally allows you to be more inclusive as well. Who in your support system can help you, or can you tell me about your significant other instead of saying, can you tell me about your husband or wife? Because even for myself, that's always an assumption, or we even have on our evaluation form a spot for wife or husband. It should just be significant other, mm-hmm. And just leaving that space open will allow the client to be more comfortable with you to maybe share more about their identity that can literally impact their health outcome.
Yeah. And something it sounds simple, right? As we're talking about this, having an opportunity, having an option where it's not a yes or a no, it's not a husband or wife, it's having it open-ended where people can share. It sounds so simple, but yet something like that, if your identity or your option is not present, it's kind of that constant reminder of it's not there, that something needs to be done, something needs to be changed about that. And I'm so glad that you're bringing these things up, because unless you've been exposed to it or talked to somebody or heard somebody talk about this, you're not going to think that it's a big deal. And so as I'm sitting here, I'm just yeah, that's so simple. In our interviews, don't just ask male, female, don't just ask husband, wife, say significant other, say who in your family is going to be caring for you. It's so simple, but so powerful.
Right. And the little tangent that you just sparked my memory on. So I worked in home health in California, and for those who don't know, there's this real nasty mandated documentation form called OASIS that's used in home health. And we had a work meeting one day about proper ways to fill out OASIS, and we came to the gender marker. So OASIS gives the option for male or female. What I learned on, and what we ended up having a really nice discussion on after I brought concern to it, was that in OASIS, you have to identify your gender based on the gender you assumed when you were born. So not by the gender you identify from. And this is important because a lot of transgender individuals, or typically the goal is to have their gender marker on all of their identification forms match their preferred identity, not the gender they were necessarily born as, hence transgender in general. But on OASIS, it's required that you enter your gender assumed at birth, which even for those who go all of the mileage, which it's no easy task to get your gender marker changed, to go through all of that and have all of your legal documents say that you're a female when you identify as female and have to put male on a form like that. It's not even just an OT issue. This is a general healthcare issue. The start of healthcare, or this process, all starts with the forms you fill out when you walk into an appointment or an office. Like, we across the board are making it so much harder for people to be okay with who they are or get good health care just based off of a couple letters.
And the fact that you just said it's not just an OT issue. Yeah, it's not. I mean, this is a global, this is a societal, like, this is a systemic issue. And I think as OTs, we have the opportunity to really kind of advocate and bring this awareness to the facilities, to the organizations, to say, hey, this is not right, as well as kind of represent this community and ally together. Let's talk a little bit about like specific ADLs, because I know when we first kind of started talking about this, you were saying that there are differences, but there are a lot of similarities. But I want to kind of talk about what are some of the differences here, and what are some unique things specifically within trans care and trans-specific ADLs, or activities of daily living, that we as therapists should be informed about, that if we are working with somebody that engages or potentially needs help to engage in these occupations, what that would look like and how we can best support them as therapists.
Yes. Okay. I'm so excited to talk about this because this is a topic I've spent a significant amount of time educating myself on recently, once I was educated on this even being a thing at the AOTA conference. So trans ADLs, which actually might be in the next OTPF. I don't know the exact verbiage, but that might be something that's actually added into the OTPF. But there are beginning rituals or activities of daily living that are unique to the trans community. So if we're talking about an individual that's transitioning from female to male, 3 common devices you may hear are a binder, bandage, or a packer, and/or. I guess those could all be and/or. So a binder and bandage, those are used to flatten one's chest. So a binder could be anything from a specific trans binder, which can be purchased, to a sports bra, which would provide that compression and flattening, or bandaging. Bandaging is a broad term, but I do want to talk about binders and binder safety because this is something that I thought was maybe most important in educating myself personally on this topic. So there are some great positive impacts of binders, which includes decrease in suicidality, decrease in anxiety, decrease in dysphoria, increased self-esteem, increased confidence or ability to go out in the public, and then increased positive mood. So knowing what we know about the mental health of individuals in the LGBT plus community, these are huge positive impacts of binders, but there can be, when misused, some really impactful negative impacts. So that could include pain in the chest, shoulders, back, and abdomen if the binder is too tight, musculoskeletal changes, including bad posture or that kind of forward bending posture from being too tight on the chest area, as well as shoulder joint popping, or rib and spine changes. So if these are worn too tightly, they can very much so impact the musculoskeletal system. Neurological changes, including numbness, headache, lightheadedness, or dizziness. People have passed out from them being too tight. Gastrointestinal changes, including digestive issues and reflux. Respiratory effects, including shortness of breath, coughing, and respiratory infections. And there can also be skin issues or breakdown, as well as breast changes, tenderness, scarring, swelling, acne, itching, skin changes, and skin infections. So with that all being said, with all of those negative impacts that I just read off to you, it was found in a significant study that the positive impacts outweighed any negative impact, though most individuals who wear a binder will experience one or two of the listed negative impacts. But us as practitioners helping someone maybe who had a stroke or just in a mental health setting, complete these ADLs, we need to know what we're doing. So there is a protocol or some guidelines on safe binding practices. I can link this website or send you the link, Sarah, for them to refer to from your show notes, just so that they can refer back to this. But things like minimizing the frequency that they use their binder, or the duration, years, or even throughout the day that they wear the binding, or using things like a sports bra or a neoprene compression wear that are more standardized. Those are all considered safe binding practice. So, okay. But I will definitely give you this link to refer back to, just because as OTs, if we don't know what we're doing when it comes to this type of ADL with these individuals, we could really have some adverse effects or impacts on their overall health. That is important to be noted. So a packer, that's the last item for those who transition female to male that I mentioned before. And this is considered a prosthetic with the appearance of a penis. So this would help affirm the gender identity of a male and give that physical appearance of a penis. So those are the three main different ADL items someone may have to don if they identify as a female to male transgender individual. Did you get all that?
I did. And it sounds like really like the education piece is kind of the most important, especially if we're dealing with somebody that's gone through an illness or gone through some sort of a disruption, or maybe their cognition has been impacted, of really educating proper safety techniques, but then also that understanding of if they do notice that there is skin breakdown or numbness or anything of kind of those negative effects that you mentioned, to bring it up, because it can lead to something a little bit more serious. But I feel like just as OTs, just as if we were going to be recommending some other assistive device, that education piece is pivotal. It's huge in making sure that our clients understand how to incorporate these techniques into their dressing to make sure that they are safe and that they can eliminate these negative effects as much as possible.
Education is so important for us as practitioners, but also to the patient, especially for those maybe who are, if we're working in a pediatric environment, who are newly transitioning and may not know this or may not have known to look up things like this too. So it's not also just when they've had a new health disparity. This is just relevant in the general transition for those who are able-bodied in a pediatric setting. So now to touch on the different dressing devices for those who identify as male to female, transgender, or transfeminine. So there are breast forms, which is exactly what they sound like. So this is a prosthetic device or a prosthesis that has the appearance of breasts. There's something called a GAF. I hope I'm saying that right. This is comprehensive underwear that minimizes the appearance of a penis. So again, this is someone transitioning from male to female. And then there's also tape. So taping can be used instead of a gap to tuck the male genitalia or the penis to help affirm that gender as well. So those are the main different dressing items that could be used by a transgender individual.
Are some of the negative effects that you listed for female to male, are there some similar, or are there some also negative things that can be associated with the male to female transition?
So from the resources I have used for education, there are none noted, but
Okay.
let's talk about it because I think that there could be breast forms if it's some sort of sports bra, maybe that's holding the prosthetic breast ends or the forms. Tightness on that could maybe have a similar effect as binders, although binders, I do know, compared to a breast form, they're going to be on much tighter because the purpose is compression. But I would think for a gaff or with taping that maybe the gaff could be on too tightly or be packing it too tightly that you could impact the anatomy down there as well and have maybe blood flow issues or just a general change in the anatomy that would be less than desirable. So I think that there's a general education that could go with all of these devices, but maybe this is also a point to prove that there's always more education that could be found on these. So I would say definitely there could be a lot of safety things included in all of these devices or dressing items, but it was most firmly noted with binders because binders were found to have the most impact on other areas of health.
Mm-hmm. And I think we've kind of just been talking about like the actual technique, the actual device that they're using, but how these specific things could also affect other occupations. Like I'm thinking about taping and potentially urinating and how this would actually impact that occupation or something, does that make sense? Am I rambling?
No,
okay.
That 100% makes sense. Think of the time it takes to dressing. I mean, just for you to get a bra on. Now we're talking about a binder or a breast form, a binder that is much more so tight than a normal bra, and donning a packer now, which is something that you wouldn't have to typically do in addition to underwear. And then what happens when you have to toilet or when you have to take a shower, you have more things to take off or to navigate around to complete these tasks. So it absolutely does impact more than just the dressing. It's the time and the safety. And then, for ADLs like toileting and maybe navigating around those devices when you have to complete that task. I do want to make a special note to more so erring on the it's not so different side, but a lot of the resources stressed being patient with and giving extra care to hairstyling, shaving, and makeup, as well as toileting. We'll get into toileting in a second, but specifically hairstyling, shaving, and makeup when it comes to individuals of the LGBT community, specifically the trans community, because hairstyling, shaving, and makeup could really make or break someone's perception of their body and where they are in their transition and overall mood. So there was a lot of stress to respect a client's routine and support them in their routine and to not, rush them through these activities because they're extra important for these populations. Although to us, they're not different ADLs. These are things that maybe women or men would typically do every day.
Yeah. And especially if it's not important to you as the clinician, but it is important to your client, that's really what needs to be on the forefront and really respected.
Right. And then toileting, just making sure there's a safe space or safe availability to public restrooms that are non-conforming for those who fall into a transgender or gender non-conforming identity. Just the research that's out there that mirrors everything I've already said with the impact on toileting and access to safe and public restrooms is so huge for our community that even just having the few public bathrooms in our facility changed to, gender neutral can have such an impact on how our patients or how their loved ones may engage in just a toileting activity where there are actual adverse effects of those who identify as transgendered in the toileting task, where there's a higher risk for dehydration, UTI, and kidney infections due to lack of access to safe and public restrooms that are non-conforming. So it's a greater issue than just the identity. It's literally impacting the health of those in the community.
Exactly. And again, this is why I wanted to talk about this, because there's so much that needs to kind of be shared. And there's so much influence and impact that can happen negatively and positively. And so I'm so glad you're bringing this stuff up and that we're having this conversation today, because I think it's really, really important to talk about.
No, thank you. I already mentioned it, Sarah, but thank you so much for this platform and this opportunity tonight to let me talk about and share something that I'm really passionate about, and for pushing me to just come here ready. I can't stress enough that this isn't even about difference. It's just about the little things we can do as healthcare professionals, just little tweaks in how we do things to just treat the entire person as we signed up to do as OTs in a holistic profession. This is just about considering the entire person and valuing the entire person and then helping the entire person. And whether that includes a different identity than we're used to or a pronoun, again, we're just executing holistic practice, which is exactly what we signed up for.
Yes. Yes to all of that. You summarized that so beautifully. I have nothing to say to that. That was perfect.
I'm all out of good things for you. So
all right. Well, we only have a little bit more to go. I know that throughout our discussion, you've talked about a couple different things that we're going to link to and some different resources, but is there anything that we haven't brought up that you would like to mention as a resource for therapists?
So there are a lot of resources. So I will provide you with that list. So I'm basically just summarizing what you already said to me. One that I like in regards to mental health is the National Alliance of Mental Illness, because they do a wonderful job showcasing issues of mental illness and advocating for specific issues that target the LGBT community. So their acronym is NAMI, NAMI.org, but I do like to reference them or review their research when it comes to mental illness and the LGBT community. The Trevor Project is one that's very well known, but that's a suicide hotline or a help center for at-risk youth and adolescents in the LGBT community, and for those who are also homeless within the LGBT community and of youth descent. But I will have a full list for you. There's like lgbthealthcare.org, but there are a good amount out there. There's one. Let me see if I can find it. So I'll include all of these too, but there are actual resources you can use as a LGBT plus individual to find safe or open healthcare providers. So there's actually a network, or our networks, like the Gay and Lesbian Medical Association's provider directory, where you can look up inclusive medical providers so you can have a safe space to access care, because access to healthcare in this community is lower than the typical population. So yeah, there's some really great stuff out there. I think it's just a matter of finding them or giving those resources to those who need them.
Awesome. And yeah, we'll definitely make sure to link to all of that in the show notes. And then I also wanted to give you an opportunity, because you are kind of in the process of starting something / have started another resource that I think that will be really good. So do you want to kind of talk about your project that you're up to?
Yes. So I'm going to talk about something that does / doesn't exist yet, but I'm super excited about all the things that it is and is not yet. So I will be launching a blog shortly, which will have the same name as my Instagram handle, which is The Rainbow OT, where I hope to spotlight stories of LGBT plus practitioners and healthcare providers and patients and share their authentic, true stories of their experiences, as well as just, I hope to be an ongoing list of resources for patients and for healthcare providers and allies. So that's an important thing to touch on too. It's not all for those in the community. It's for those who wish to be an ally or wish to be educated on the subject. So I hope to just share my story as a traveling occupational therapist and an openly gay healthcare provider, but also use this blog primarily for LGBT plus advocacy and education and a sense of community for those in the healthcare setting. So stay tuned for all of that. But that's my project that'll be launching either by the time that this airs or shortly after. So if you're looking out for it, head to my Instagram, The Rainbow OT, and there will be a link there once it is up and running.
I am so excited to see where you take this and everything that you are able to include onto your blog and the resources that you can provide for therapists and for people. I'm so excited. I think this is it's in such need, especially within our profession, and really just to kind of continue this conversation, continue the awareness, continue the education, and be a resource for people that are looking for more information about some of the things we talked about, and then some of the things that we didn't even cover today. Because I know we talked about a lot of different things. And so I'm so excited. I can't wait for it to come out. And let's see. I guess I just have my last question for you, unless there's anything else that you would like to say.
No, I think we covered it all, and for the third time, but seriously, I'm never going to be done thanking you. This is for my podcast debut, which I'm sure I'll look back and be like, sweet baby Jesus, we've come a long way, which is great. I can't wait for that moment. But just for this space and this time again to talk about things that I'm really passionate about, and I'm passionate about learning about more and educating others on, because I think that we can really make an impact on a lot of those statistics and just on the general health of the LGBT community, LGBT plus community, and for practitioners and for patients. So thank you again for just this time to talk about this.
Amen to that. Okay. All right. Last question. If you only had one word to describe occupational therapy, what would it be?
Oh, the first word that came to mind naturally was magical. That's it. Just magical.
Yeah, I think that was one of the very first words you said in the podcast. And here it is, like all encompassing. We're circling back. Magical. I love it. That's amazing.
Well, you know what? It's true, though, because whether it's magic of having someone put on a shirt after suffering something as, intense and enduring as a stroke, or it's magic in a child eating their first food that wasn't of yellow color, or if it's magic of, I don't know, any of those victories we have as OTs, which are so expansive. Like, it's all magic. So I think what we do is magical. I think our limit is endless, and we're all unicorns.
Thank you so much for taking the time to come on the show today, Devlynn. This has been so good. Amazing. I know myself, I've learned a lot just from this conversation and the things that you've posted on Instagram so far. And like I said, I'm really excited to see where your blog takes you and really kind of what this can bring to the table for our profession and our society as a whole. Well,
I'm going to say thank you again, but no, thank you for just being so genuine and so open. I cannot, for anyone who's a listener and hasn't had the pleasure of meeting Sarah in person, this whole connection manifested at AOTA, where we, at the same time that we followed each other on social media, became best friends in real life. So you are magic, and our profession is forever better because you are in it, and you're giving a space for people to talk about just a diverse amount of things that are so meaningful and important. So thank you, and thank you again for this time and your time.
Hey, before you go, I just wanted to say thanks for listening to today's episode. If you want to further the discussion, go to our website, otforlife.com, and join our Facebook group. If you like us, here are 3 easy ways to let us know. 1, share our podcast with a friend, colleague, or anyone interested in occupational therapy. 2, leave us a review on iTunes or anywhere this podcast is found. 3, subscribe to us so you don't miss out on any upcoming episodes. Thanks again. We'll catch you next time, OT for Lifers. Deb, that was so, you're amazing. Oh my goodness. You're gonna make me cry. My goodness. I can't handle this. Yeah, I can hear you.
Are we in a happy place? Yeah. Ain't nobody got time for that.
Nope. What is that? What is that?
You got some cool effects on?
Yeah, I guess so.
It's coming, people. It's just going to be that surprise you didn't know you needed.
Uh-huh.
Known, I guess. This is an area where you could totally edit out.
Okay.
But those...
but not enter. Oh, dang it. What was the word that I wanted there? Oh, there we go.
Can I say badass on here?
Yeah, why not?
Okay.
Within the healthcare setting, gosh, I can't talk today. Ugh.
Oh, where was I even going to go with this? Jesus Lord.
I was talking about expectations and the pressure that we put on ourselves. Does that help?
It does.
Being able to sleep at night.
Yeah, I was going somewhere so different, but I'm gonna.
Well, then I can't help with that.
No.
You said it was like another thing that, without going too deep into.
Yeah, what was I? Wow, my brain is fried. That was a total fart moment. I hope you enjoy this when you edit it. You can go back through and just listen to this moment of me not remembering what I was going to say. I was going to say something about. Oh, so I was going to talk. I'm going to. Okay, you're going to.
What was that?
Okay. Well, you can edit this whole point out because I'm gonna wrap up with what you were saying, and then I have something else to say.
Okay.
Parallel to it, but nailed it.
Got it. Still reading it though.
That's okay.
Like blah blah blah. What's the word I'm going for? I don't know where I'm going for. I don't know. Like.
Love.
Yeah, this is it. Where I'm like a rambling hot mess, and it's totally cool.
I found the most awkward way to say that I possibly could, so you're welcome for that. Oh, I'm sorry. Well, that too. I'm gonna start over.
Yep, go ahead. This might just be like a stupid question, but I'm gonna ask it because maybe it's a good question.
That 100% makes that. Never once did I think I would be in this very moment. Even a year before now, I would have never thought I would have had my own Instagram, talking about these things, or even had the courage to kind of, I guess, be different and talk about things that make people uncomfortable. And to have this space to do it is huge. I look up to podcasters. Like, I would have never thought I would be on a podcast. So this is craziness to me. So thank you. Seriously.
I like in all transparency and in all honesty, I was definitely uncomfortable talking about this because while I consider myself extremely respectful and open, and I try to be as non-judgmental as possible, I'm also not super well versed in it either. And so I just didn't want to come across as rude because I just didn't know, like, if that makes any sense. And so it was like, I really tried my best to be as respectful as possible, but also like, I just kind of putting it out there because I'm sure a lot of people resonate with me where they're like, we want to be better and we want to learn about it, but we just don't know yet.
Well, you want to know what's funny about that? And it's just from like me having the experiences I had. I could tell because, and I was going to ask you about it, and that could have been a good, we already kind of covered that in conversation, but earlier, it was before we even started talking, and you said, like, I don't remember exactly what you said, but you said gay for me. Like, you identified me as gay, which I openly identify as. I could tell that you hesitated for a second, and then you said it, and I didn't say anything about it, so you kept going, but I could tell, like, you weren't sure about how that was. Like, that is fine, and that's what it's about. That's like, to me, no different than talking about a vagina. Like, I know nothing about it. It's uncomfortable to me. I don't want to know anything about it. But, like, I have to talk about it with patients,
right?
So thank you for just taking it on, because you're right. I don't think anyone's really talked about those things. And now, because of you, they're going to hear it. So,
yeah,
so awesome.
that's the big thing. Like, and this whole experience of like podcasting and social media and whatnot I'm kind of just like, you know what? These are important topics. I am learning how much I don't know throughout this whole process, putting it out there, hoping that some of the questions that I ask my guests are questions that the audience will also have, and just trying to be true to myself and try to like open up the lines of communication and just awareness, like really. And I will be doing a monologue about me and about the purpose of the podcast, because I have not done that yet. But really it is to promote the profession, advocate, all that good stuff. But B, it's really to plant seeds in people's minds. And even if nothing becomes of it, it just is putting the information out there so people start to become aware of it. Because you don't know what you don't know until you know it. And so it's really important to just start talking about things and have people start to listen, even if it's not something that they're even going to act on or anything like that. But at some point, they might reflect on it, or it might change the way they think or add to their knowledge base, or however it impacts them. I'm not sure. But really just planting that seed for education and growth and progress.
No, I love everything you stand for so much. And that's in an LGBT plus scope. That's what I'm hoping for my blog to be.
Exactly. I mean, and I think you kept saying like, I don't know everything about this whole, about the entire topic, but here's what I do know. And I think that's just really important to just, again, embrace yourself and put it out there. And hopefully I'll get feedback on this episode, and maybe somebody else is going to say, hey, this needs to be talked about. And then I can bring them on or bring you back on and talk about it, whatever. Like, yeah, like I do hope that we look back and we're like, ooh, okay, we've come a long way, but this is who we are right now. And this is what we felt like needed to be talked about. So
there.